Picture this. You take a life-saving statin for your heart, wash it down with a glass of grapefruit juice, and suddenly, boom, your medication turns toxic.
Yeah, it's a terrifying scenario.
Okay, let's unpack this, because behind every single pill is a seriously high-stakes protocol. Today, we're doing a deep dive into pharmacology, pulling from an NCLEX medical training module to uncover the hidden systems that keep medication from, well, turning into a disaster. The margin for error here is practically zero.
It really is zero.
Huh.
And we all know the absolute baseline that gets drilled into healthcare workers, right? The 5 rights.
Right. Right patient, right drug, right dose, right route, and right time.
Exactly. But what these materials highlight isn't just the rote memorization of that list. It's about how easily the right dose becomes the wrong dose the second the environment changes.
Yeah, the 5 rights feel less like a checklist and more like, a strict cybersecurity protocol. It's essentially two-factor authentication for medication.
That's a great way to put it.
Because you don't just ask for a name. You verify the wristband, check the chart, look at the ID number. But the module also includes these additional rights. And the one that really stood out to me is the right to refuse. It acts like the ultimate override code for you, the patient.
And that override code is crucial because it legally and ethically enforces your personal autonomy. But, let's look at what happens when the drug is actually administered.
Right.
The system sort of assumes a perfectly controlled environment, but pharmacology is wildly volatile. Take high-alert medications. The protocols for drugs like insulin or heparin require a physical double check by a second licensed professional before they ever even reach the room.
I was actually looking at this list of high alert meds in our sources, and I was a bit confused. I get why heparin, a blood thinner, is dangerous. But potassium chloride?
Yeah, that one surprises people.
Right. People eat bananas for potassium every single day. Why does a standard electrolyte require a 2-person verification?
Well, it comes down to concentration and delivery speed. Like an oral potassium supplement or a banana, it takes time to digest and absorb.
It's slow.
Exactly. But giving concentrated potassium chloride intravenously, that directly alters the electrical impulses of the heart muscle immediately.
Oh, wow.
Yeah, so a miscalculated IV push doesn't just cause a stomach ache, it can trigger instant fatal cardiac arrest.
So the delivery route completely changes the threat level, which brings me back to that grapefruit juice scenario. We think of the hospital as a controlled environment, but the real chaos starts the second a drug collides with a patient's kitchen. How does a breakfast drink turn a standard statin toxic?
What's fascinating here is enzyme hijacking. So grapefruit juice contains compounds that actively block an enzyme in your digestive tract.
The one responsible for breaking down the medication.
Yes, including statins.
Huh.
So because the drug isn't being metabolized, it just builds up in your bloodstream to toxic levels.
That is wild.
And on the flip side, if you take a tetracycline antibiotic with, say, a glass of milk, the calcium in the dairy physically binds to the drug in your stomach.
So the milk acts like a physical shield, completely blocking your body from absorbing the medicine. You might as well not have taken it.
Precisely the opposite effect of the grapefruit, but just as problematic. And natural supplements do this too. St. John's wort is notorious.
Really? Just an herbal supplement?
Oh, absolutely. If you mix it with a prescription antidepressant, you're stacking mechanisms. St. John's wort prevents your brain from reabsorbing serotonin.
Okay.
So if your prescription does the exact same thing, you flood the brain's receptors, which triggers a toxic, potentially lethal neurological overload known as serotonin syndrome.
Man, if a glass of milk or an herbal tea can just completely sabotage a treatment plan, the doctor's prescription is really only half the battle. So how does the medical team ensure a patient doesn't accidentally sabotage their own recovery as soon as they go home?
Well, this is where the teach-back method becomes the ultimate safety net. It's not just asking, do you understand?
Because most people just nod along to that. I know I do.
Right, exactly. So instead, the provider asks you to repeat the exact instructions, the dose, and the side effects all in your own words. It proves the information actually landed and that you know exactly what to avoid.
It forces the system to strip away the dense medical jargon. You become an active partner in the pharmacology, like you are the final checkpoint.
You are. It is a delicate balancing act. Pharmacology relies on this constant, rigorous process of maximizing a drug's benefits while neutralizing its risks through these strict protocols and continuous education.
So what does this all mean for the future? We've talked about manual double checks, two-factor authentication, and the teach-back method to prevent these chemical collisions. But as medical technology advances, how close are we to a reality where pharmacology is perfectly tailored to your unique genetic code?
Oh, that would be incredible.
Just imagine a world where adverse reactions and drug interactions are entirely eliminated because the medication is formulated for your exact DNA, automating that safety protocol entirely.
A total game changer.
Until then, keep asking questions and remember the power of the teach back.